a number of different areas. What I'm going to try to do in each briefing is create as much continuity with the previous briefing as possible. And as I said, I think we are going to be doing a lot of these for the weeks to come. So let me start with, yesterday we talked in detail about the family from Westchester and the law firm Lewis and Garbuz, where both the mother and father of that family worked. In addition to the mother and father, 8 other individuals at the law firm, 7 employees, 1 intern, 4 residents of New York City, 4 residents of areas outside New York City, all have been tested. Here is what we know so far. For the 4 New York City residents, the tests have all come back negative. For the 1 resident beyond the couple themselves from Westchester County, the test has come back negative. We have 3 more tests pending. We will have those results today, and we'll publish them as soon as we have them. And everything's very dynamic, as everyone is seeing, so these numbers can move at any given moment. But as of this moment, I've got, obviously we'll talk about the 4 confirmed cases, the 4 cases that tested positive. But now the number of negative cases is 26. We have 26 tests completed, come back negative. We have 2 new cases confirmed this morning in New York City, a man in his 40s, a woman in her 80s. Both are critically ill at this moment. Both did have substantial pre-existing conditions. In the case of the man, respiratory issues related to smoking and vaping. In the case of the woman, specific illnesses related to her advanced age. One is at a hospital in Brooklyn, one is at a hospital in Manhattan. Again, we're going to try always to define what we are able to tell you, what we're not yet able to tell you. Obviously, there's a confidentiality issue here that we have to be sensitive to. These are voluntary hospitals, not public hospitals. Okay, now this gets into the issue of community spread, which we're very, very concerned about, obviously, and this is kind of defining changing reality. So today we're going to be talking about some strategic differences even compared to yesterday, now that we have more evidence of community spread. So in the case of these 2 individuals, neither one had a connection to the areas affected in other parts of the world. So there's no travel nexus. Neither one connected to any of the other cases we've seen. Our disease detectives are working with their families right away on mapping their contacts, and we'll have more to say on that shortly, and we'll obviously be following up with any close contacts. The community spread issue, we are seeking guidance from the World Health Organization and from the CDC, now that it's clearly established as a phenomenon here. We are trying every day to get a better understanding of this still new disease. We are not getting all the answers we would like, but to be fair, the entire medical community around the world is trying to get clearer answers and clearer facts. What we do know is when you have a community spread dynamic, you have to assume it could be anywhere in the city. So we're going to work on an assumption of intense vigilance. We're going to update our approaches as we get more information. A phrase that I've just learned, transmissibility, is sort of the amount or the ease with which this is transmitted. World Health Organization continues to say this disease is less transmittable than the flu. But again, we are watching carefully. Community spread dynamics suggests it will be more pervasive, and that worries us, obviously, in terms of how easy it might be for someone to come in contact. Again, goes back to what people can do, and this is the consistent part, because it is affirming, as we used the example yesterday of the measles, it is not a disease that the substances hang in the air, and if you come into a room where they've been present that it's easy to contract. We know that is not the case. What we're concerned about is direct contact with fluids. And so that's the area where people can do all the smart basics, the hand washing, the alcohol-based hand sanitizer. Thank you, Commissioner, you've gotten that in my brain. Obviously, covering your mouth when you cough and sneeze, all those basics really matter. Notwithstanding our real concern about the situation, the overall numbers still remain, in a sense, very favorable. We have only 4 confirmed cases, obviously, out of 8.6 million people. We have 26 tests that come back negative. I want to note, I should have said this up front for continuity, the 2 yeshiva students who the disease detectives identified from the first yeshiva student, so that is the roommate and the best friend of the student from Westchester, both have been tested, both came back negative. So they're in that negative number of 26. So again, by the numbers, we remain in a strong situation. The community spread dynamic is unpredictable and worrisome. So we're watching carefully, and I want to alert everyone. Each day we may tell you we're finding something new about how this disease is acting in general, how it's acting here in New York City. So our level of concern is rising for sure. That said, the big picture point, I'll keep saying it, we do know this for a fact, over 80% of the folks who get it have very mild symptoms, very mild experience, and the vast majority of folks, even who have more serious outcomes, still end up seeing it through. So it comes back to, I'm making really clear, we believe in a containment strategy. We understand there are limits to that at a certain point, but that is the strategy we're using. We believe in a strategy that focuses on identification and testing. We believe deeply in the work of the disease detectives, and we will be introducing you to some of them soon so you can get to see the real human beings who do this important work. But finding everyone who needs a test and getting them a test as quickly as possible and isolating them when they need to be isolated is the smart strategy. We have a directive for all New Yorkers. And I'm first going to talk about all New Yorkers, and then I'm going to specifically talk about city workers. For all New Yorkers, if you have returned from one of the 5 countries I'll indicate, we're asking you to isolate yourself for 14 days as a precaution. Any New Yorker coming back from any of these countries, China, Iran, Italy, South Korea, all on the current CDC list. Japan should be on that list, we believe. So from the point of view of New York City, if you're coming back from Japan, you should isolate for 14 days. And obviously, if you have symptoms, then you need to get to care and testing. Now, this is a brand new thing I'm going to introduce to you today, thanks to our health commissioner. This order is being issued as we speak, commissioner's order. And this refers to city workers, specifically first responders, healthcare workers, and educators. So this will be up online momentarily. Under this order, the commissioner has the ability to determine case-by-case specific actions. And if the commissioner determines that anyone fits the criterion, is a risk, they can be required to get a coronavirus test. Right now, I can tell you, anyone who has traveled to one of the affected countries and has symptoms will be required. And the broad assumption is that those who have symptoms alone, except for particular extenuating circumstances, anyone who has symptoms will be required to get tested, and we will act in accordance to that test in terms of if and when they can return to work. Anyone who refuses testing must comply with a quarantine, and there will be specific employment consequences if they refuse testing. We'll get you the details on that. I want to also emphasize, again, I think we're in a very dynamic crisis, which I have said to you guys, I believe will be months if we're lucky. This is the first commissioner's order. I doubt it will be the last. You will see evolving actions This one refers only to city workers. Obviously, the commissioner has the power, and I have the power to do things related to the general public as well. So we're going to take each step as needed. We'd love it if we don't have to take a lot more steps, but we are prepared to do a lot more the moment we need to. Consistent with the topic of city workers, update related to schools. So we have 3 teachers who have recently come back from Italy. I'm going to give you a lot of detail on one, and then there's 2 more where I can give you a little detail, but we will have more specific as soon as certain notifications have been made. The first teacher was part of a high school trip at James Madison High School in Brooklyn, 3787 Bedford Avenue. 44 students and this teacher plus 6 other staff members went to Italy. My understanding is to one of the affected areas of Italy, and that's important here. Obviously, countries are experiencing this crisis, but there are areas of particular concern. Came back on February 23rd. The teacher was symptomatic. The teacher has been tested. The teacher tests negative. We are assessing all the other staff and students on the trip. At this moment, we have none with symptoms. And we believe we have a low-risk situation, especially given that we're getting close to the 14-day mark. But they are being carefully assessed. If anyone needs testing, they will get it. This is a good example of a situation I want to clarify about. We've been talking a lot about how to talk to parents. And I'll say this, and at any point now or in the back and forth, my health colleagues will jump in. But the basic guidance to parents who are very, very concerned right now is if your children are healthy, at this moment there's very, very little to be concerned about. If your children have serious respiratory diseases or a compromised immune system, we want you to be extra vigilant. And we want, in that case, we obviously want to make sure our schools are aware of those particular students. So looking to the chancellor and the health commissioner and the deputy commissioner that we obviously have the ability with school records and school health facilities, something you used to do, to understand school by school who those students are. We're going to have particular sensitivity around those students. But at this moment, because there's not a single symptomatic student anywhere in New York City public schools that we know of, we're not taking an additional action. But that, just the human guidance to parents, and I'm saying this as a parent, based on what our public health officials are saying, is only if your student has a serious respiratory problem or a compromised immune system is there an immediate threat. Otherwise, as everyone is seeing, this disease disproportionately affects older folks and folks with serious pre-existing conditions, but obviously, overwhelmingly, it's been adults. 2 other teachers. In this case, they both returned from a vacation in Italy over the winter break. So again, we're getting close to the 14-day point. We will have more information shortly. Both are being tested today. We'll have the results on that shortly, and then we'll talk about pending notification of the specific schools and any other follow-up. But again, those teachers just went themselves personally on vacation, not with students or other staff. Want to give you a couple of agency updates. Department Correction. All housing units, day rooms, and common spaces are now being cleaned once per day. Shower areas are being cleaned 3 times per day. Transport buses are being cleaned and sanitized daily. Staten Island Ferry, every ferry, each boat will get a deep cleaning every 72 hours minimum, often more than that, more frequently than that. Terminals will be consistently cleaned, constantly cleaned. DOT crews are also handing out material on the ferry to educate customers as to the facts on the virus. Those, I obviously gave you some other agency updates yesterday. Those are some of the things that are happening in our government, but I want to emphasize what we need from another government, the federal government. This is Still the case, even though there was a little progress the last few days, it's still not what we need. We need the ability to test as many people as possible, as quickly as possible. We cannot do that without help from the federal government, period. The CDC has finally broadened the criteria, which is good, but we do not have the physical capacity we need. We need the FDA to speed up approval of the tests developed by private companies. We just need this to be a consistent effort by the federal government. It has not been. The goal has to be to decentralize testing as quickly as possible and maximize our ability to do what we need to do. One other piece of news literally coming in just before I came out here from New Jersey, but related to us. We have one new case in New Jersey that has a significant nexus to New York City. We don't have the details yet. Our health authorities are speaking to the New Jersey health authorities. I will be speaking to the lieutenant governor, who's in the role of acting governor because Governor Murphy has been in surgery. So acting Governor Sheila Oliver, I'll be speaking to her later on today. We will get you an update as soon as we have more of the details. We're going to have our disease detectives engaged with the health authorities in New Jersey to track what that nexus is. So we know there's a case and we know there's a nexus, but we don't have the details on that. Hopefully we'll have that in a matter of hours. Few quick words in Spanish, and then I'd like to have the Speaker of City Council, Corey Johnson, say a few words before we open up to questions. Confirmamos que ya hay más casos de coronavirus en la ciudad de Nueva York. Necesitamos que el gobierno federal actúe más rápido para que podamos ofrecer el examen de coronavirus a más neoyorquinos. Si tiene algún síntoma, vaya al médico de una vez. With that, I'd like to turn to Speaker Johnson.
Thank you, Mr. Mayor. I want to thank you for the level of transparency that we have been showing as a municipal government, which I think is incredibly important. I want to thank your team. I especially want to thank Dr. Barbeau for her steadfast leadership throughout all of this. I know that there is a lot of misinformation out there, so as the mayor has done consistently, I think it is important that we urge the public to be guided by fact and not by misinformation, not by fiction. You can still ride the subway. I did it today from Union Square down to City Hall. You can still go to school. There are plenty of young people who are in our schools today. You can still go to work. New Yorkers are still working all throughout the 5 boroughs, and you can still go enjoy a concert or a basketball game. It's important that we get out there, that we are taking the precautions necessary, that there is, of course, rightful concern about what the city is dealing with, but it's also important to know that we are being guided by experts. And those experts are our public health department, one of the best in the world, and the disease detectives that the mayor talked about that are doing this work every single day. So it is natural that people have questions. It's natural that people have concerns. And it's why in just a little while we're going to have a hearing at the City Council, not a long hearing, but a hearing with the professionals that are sitting up here before you to, again, answer these questions in a fact-based, sober way to New Yorkers. City Council members' offices are getting phone calls every single day from constituents that are concerned and want the facts out there. And so the mayor has been doing that. The governor has been doing that. The council is going to do that in the form of a hearing today. People are rightfully concerned, and I want to thank the administration in advance for participating in that hearing and for the work that we have done together. I think it's important to update the public and provide them, as we have been doing, as the mayor has been doing, every day with transparent, accurate, fact-based, science-based, sober information that people can use to deal with their concerns. And then just lastly, we know that there are likely going to be new confirmed cases in our city in the upcoming days and weeks. And the way to combat that is to use the facts, use the science, listen to the public health professionals. If things need to be escalated at some point, that will be communicated to the public. That is not where we are right now. And again, to ask the public to use common sense health measures, to wash their hands, to use the hand sanitizer, to cough soften their elbow. And then lastly, one final thing. Last night, my boyfriend and I went to dinner in Chinatown on Bayard Street to one of my favorite restaurants, Deluxe Greenbow, and we had some soup dumplings, and it was great. The thing that wasn't great is that a lot of the restaurants were empty in Chinatown. And we have been seeing this in Flushing, in Sunset Park, in Chinatown. We have been seeing anti-Asian bias incidents happen throughout the city. We have even been seeing anti-Semitism directed at Orthodox New Yorkers. It is unacceptable. It is not based on science or by fact. We will not tolerate it here in New York City. We will be guided by public health professionals, by the mayor and his team, by the governor and their teams. That's what we will do. We will not put up with people discriminating against New Yorkers based off of prejudicial, incorrect information, and it's important that we continue to say that over and over again. We are better than that. We are the greatest city in the world, and it's time for us to show it in the midst of this crisis that we're going through. 99% of New Yorkers have been showing that, but for the 1% of New Yorkers that are behaving this way, stop it. It's unacceptable. We won't put up with it. It's not the way to get through this crisis. Thank you, Mr. Mayor.
Thank you, Speaker. I couldn't agree with you more, and thank you for that rightfully passionate statement. Yeah, we're just not going to I want to amplify it. We're not going to accept any discrimination. There are real consequences. Some forms of discrimination are illegal, and you will feel the consequences of it. But also, if anyone's paying attention, this disease is now in, I think, 79 countries of the world. So it is unfortunately affecting people of all backgrounds, all nations. We have no time for discrimination. I also want to thank the Speaker. Appreciate the hearing he's having. I also want to thank him for riding the subway. I want to inform you all that I'll be going from City Hall to OEM by subway, and you will all be welcome to join. Anyone who wants to come along a little bit later on this afternoon. Go ahead, Katie.
So the CDC added Italy, gave it a level 3 non-essential travel warning a week ago. I want to know, why didn't the DOE, and if they did, I'd be happy to be wrong, why didn't the DOE proactively go and see what schools had trips to Italy and the other countries, South Korea and Japan? We're just now finding out that 50 people from a school traveled to Italy for February break. One had symptoms. And I just want to know if that was done, let me know, and if it wasn't, why not?
So again, you said it was added a week ago. These trips were in February. So as the information was coming to us, we're going back and finding out where our students going, where were these trips planned for. Large agency, lots of groups moving. The good news is going forward, we have very, very clear protocols. We now have an inventory of all of these trips, even trips to non-designated countries. We're sharing those trips with our partners in the Department of Health to make sure that there's nothing brewing that they know of that we don't know of. So going forward, we have tight controls.
Did you not have an inventory before? And could you let me know if there were other trips made during February break?
Yeah, we can get that information to you. But again, we are going back, and there are some trips, quite frankly, that even are unofficial trips. They're paid for by parent organizations. They're paid for by church-related organizations. So we're trying to get an inventory of everything and everywhere, and we're in the active process of that. We've been doing that for about a week as well.
With all due respect, I know teachers who probably can't go to like the Hall of Science without notifying their district. I'm just trying to clarify, you mean the Department of Education wouldn't know if a school-sanctioned DOE trip with 50 people from...
That's not what I'm saying. What I'm saying is that there were a lot of trips. There was a lot of information. CDC was changing and giving different guidance. We were working through the Department of Health as well. A lot of moving parts.
Right. Richard, let me just for everyone's sake, I used to know when I was a parent. I don't know what this year the exact dates of winter break were. If we could give that, I don't know if you have it at your fingertips, but we can get the exact dates of winter break. I think it will help to answer the point that's being raised here. But the bottom line is we're going to inventory everything now and go back and look if there's anything we need to follow up on specifically.
The point wasn't that they shouldn't have traveled. It was that once they returned...
I've been very clear. We're going to inventory everything, and we're going to be very transparent about it.
I just want to clarify 2 points. The first, the 2 new cases in New York City, the man in his 40s, the woman, is there any connection between the 2 of them?
No.
No. And can you clarify?
I'm going to double check. No. No.
And are there 3 confirmed cases in New York City or 4?
4 if you include the guy from Westchester who worked in New York City, lived in Westchester, but is in a New York City hospital. So we're calling that New York City for the sake of abundance of inclusion.
You're saying 4 in New York City, but that includes the Westchester.
Correct.
About the lawyer, his wife, do we know if his wife had traveled to Israel?
He traveled to Israel. I don't know if we know his wife traveled to Israel.
I'm not aware of her travel itinerary. We do know that he traveled to Israel, but way before he got
But she is, again, there's so many cases I'm trying to make sense. She's asymptomatic.
Correct.
Okay.
I have two questions. One is, yesterday you said there'd be an update to the protocol regarding staff who show symptoms at school.
When you say staff, I'm sorry.
Teachers at
Teachers,
schools.
yeah. That's the commissioner's order.
Okay, so that is how you're dealing with teachers at schools also, the teacher who you said today had been tested, it was negative. Is that the same one that we talked about at yesterday's?
Yes. I believe it's the same one. I think, again, I'm trying to keep my continuity tight. I'll say it again, just make sure we're all over communicating. James Madison High School, this teacher went on an official school trip with students over there, again, tested negative. We'll have the other two teachers' results today.
Mr. Mayor, can I amplify? There was additional guidance and protocols that were sent to all 152,000 employees in the DOE today with very specific instructions. We've also updated our guidance to all principals about how to work with students, how to work with other staff members if they are presenting. So there's been updated guidance as well.
Just ask the DOE press office to share that, because we haven't been able to get any.
Yeah, absolutely. Absolutely. Just went out.
Go ahead.
Chancellor, can you relay your reassurances via Spanish, please?
Sure. Say that again.
Can you just relay any reassurances by Spanish?
Sí, para todas las familias que hablan español, estén asegurados que tenemos información en las manos de nuestros directores, en las manos de nuestras escuelas, que tienen instrucciones específicas acerca de cómo tratar con niños que están demostrando síntomas de la influencia, de la gripa. También tenemos a personas identificados en cada escuela que están capacitados para poder servir y ayudarles a las familias, ponerlos en contacto con las autoridades de medicina o de salud.
Just a few questions wrapped up under the quarantine headline. There are 1,000 people quarantined in New York State. I wondered how many in New York City. Are any of those involuntary? And how many how many Department of Health staffers do we have to check in on them? And are you worried about a shortage of staffers to check in on the quarantine?
The last point I'm saying, we're obviously in a crisis. The message to the Department of Health is that whatever staffing they need, if they need to hire new, if they need to gently borrow from health and hospitals, which has been wonderful about offering personnel, or from any other agency, there's not going to be a staffing shortage. That will be whatever they need, whenever they need it. As to the quarantine numbers and whether there's any involuntary, you two.
So I'll start and then.
Turn that on.
Sorry.
Yes.
I'll start and then Dr. Daskalakis can add anything that I've missed. With regards to individuals that are returning from the involved countries, the guidance from CDC, and we, along with our state partners and various jurisdictions across the country, are taking the approach of providing them information when they get off the planes, giving them our phone number, what symptoms to look out for, and then we reach out to them on a daily basis to make sure that they are not developing symptoms. It's what we call voluntary home isolation. And so they have a phone number to call us if and when they develop symptoms. There haven't been any individuals in that group that have reached out to us thus far. And then there we have individuals who are in mandatory quarantine, and I'll let Dr. Daskalakis speak to that.
Currently, individuals who are under mandatory quarantine really fall into two categories. Individuals who are, actually three, individuals who have active COVID-19 disease, so they're in isolation. There are also individuals who are close contacts of a COVID-19 case. Those are also individuals who are on quarantine. Then additionally, it is a dwindling population of individuals returning from Wuhan, China. So currently there is no one who meets that criteria.
And so what's the universe? How many people are in quarantine, mandatory versus voluntary?
If there's any, let me pause you guys. It's a very, very fair question. If you are 100% sure you have all the up-to-date facts, give them. If not, we should get back shortly.
So we have the we have the two individuals that we have identified earlier as having a travel nexus to Iran. And in addition to that, we have a number that changes on a daily basis in terms of returning passengers from the 5 affected countries: China, Italy, Iran, South Korea, and now Japan. And so that's a fluid number that we can get back to you on. I think, yeah, we'll get back to you on that correct number.
Sorry, one last follow-up. How often are those unannounced spot checks that you mentioned yesterday?
During the period of quarantine, they're done a couple times a week.
Yeah.
Is there a nexus with the 42-year-old man in Nassau County who was diagnosed with the COVID-19 to New York City?
I have not heard, haven't heard on that one if there is a nexus. Do we know anything yet?
Which person in Westchester?
In Long Island in Nassau County. The governor today said that there was a 42-year-old man who tested positive. Are you looking to see if there's a nexus, or you know that there isn't?
We'll have to follow up. Usually what will happen is they will reach out to our disease detectives to have conversations, so I'm sure that those are happening, but we'll follow up.
I'll clarify how many tests New York City has if you're running low, and also the type of test, if it's the one developed at Albany or if it's a CDC test.
So currently we have enough tests to test around 1,000 people. The test that we're currently using is the kit that was shipped by the Centers for Disease Control. We have not brought the New York City cooperative test on board yet.
What is the nexus between the New Jersey case and New York City?
That's what we're waiting to find out. So we do believe from the initial information there will be, for example, someone who works here, that's the kind of thing. But it's really literally was breaking before I came in here. So we know enough to say we assume it's someone who's been in New York City a lot, and there may be that kind of contact. We got to get our disease detectives connecting with the New Jersey health officials and map that quickly.
Do you know anything about their travel plan?
We don't know anything yet, but we'll know more in the next few hours. Go ahead, Rich.
I may have missed this, but the 2 teachers who came back from vacation, were they in a school when the decision was made to test them, or had they not been back into the school building, or did they voluntarily say, we ought to be tested, or what happened?
Richard, correct me. I think both have been home for a period of time. Is that
They've
right?
been at home. Yes,
Right.
correct.
The whole time since they got back. So just let me do this fact point. Just we're going to really always try and shower you guys with facts. Winter break, Saturday, February 15th to Sunday, February 23rd. I did math. 11 full days, including today, since then, not including February 23rd, which would be the day they either were traveling back or they were already back. But if you want the cleanest interpretation, it's been at least 11 days for anyone who was overseas on winter break, maybe more in some cases. So in this case, or these 2 cases, Richard, did they stay home since, to the best of your understanding, or do we need to confirm that?
So best of my recollection, they were in school for 1 day, did not feel well, went home, and have not been back in school since.
Okay, we're going to confirm that. We'll get you the exact details on that, and we'll get you the results on their tests. Aaron?
Can we get some more clarity on the commissioner's order? So this is, you can order testing under what circumstances?
Can I just confirm to colleagues, is it online yet? When will it be online? Momentarily? Okay. Go ahead. I'm sorry, Aaron.
What are the circumstances under which you can order a city employee to take the test?
I'll start, and the commissioner will get into more. That begins with if they have been to one of the countries they're experiencing the crisis within the time frame, and especially if they are symptomatic. But again, it gives the commissioner the right to make that determination. Simply being symptomatic is sufficient. So far, you and this.
We should just
I'm
leave it on.
Gonna leave it on.
That's absolutely right, Mr. Mayor.
If they refuse to do that, you said they will be quarantined. Is that a mandatory quarantine?
Mandatory quarantine.
Okay, and you said they would face discipline. Is that termination, or is the type of discipline specified?
It depends on the employee, but the point is we want to be very clear. Look, I come at this in a positive spirit. I think everyone would want to follow the commissioner's orders in the name of their own health, their family's health, and the people they serve and come in contact with. But I'm just trying to be very straightforward from the beginning. This is not optional. This is required.
And is that a response to anything? Have there been city workers who have not wanted to take the test?
This is, given the severity of what we're talking about here, the situation we're facing, we want to be very clear from the beginning that it's not optional. So I'm a believer that if you make clear as consequences, it helps people to understand.
Finally, is there a reason city workers specifically, as opposed to this applying to anyone? Does it have to do with the authority you have?
The city workers in this case, the healthcare workers, obviously I think it speaks for itself. These are folks who we need, and we need them to be healthy, and if they are in contact with other people, we cannot take a risk if they might spread disease. First responders, exactly the same point. Educators, additional sensitivity because they come in contact with children, even though, again, this is not a disease that seems to focus, if you will, on children. Those three areas to us just made total sense to delineate. We have the option of going further into the general public in different ways if we need to. It was something we're going to assess day to day, hour to hour. Go ahead, Ashley, did you have? No? Yes.
I wanted to ask, we have a lot of large events coming up, it's getting warmer. What's the threshold for deciding whether or not to cancel those events? And a follow-up question, there are areas in the city like the South Bronx where there are high rates of childhood asthma, and do you have specific plans for areas like that?
So on the first point, this is something we're asking ourselves regularly, we're watching, and again, I think to be very clear, the last 24 hours have changed the dynamic with the first community spread. So previously, we went quite a while where the only impact we were feeling was directly related to travel, or even for quite a while we weren't feeling any impact, right? So now with community spread being established, it will be a constant discussion of whether we need to start canceling events. We are not there yet today, just based on what we're seeing, the limits we're seeing, the numbers on the testing and the high rate of negatives. We're not there. It is a constant conversation, and this is the group right here that will be making that decision together. There's not a formal rubric we're talking about a lot of factors, but I will ask the question, is there a model rubric from either CDC or World Health Organization?
There isn't. Generally, we take into consideration the severity of the illness along with how far wide it has spread.
Be like parameters, let's say indoor events as opposed to outdoor activities?
But again, I want to clarify. In theory, yes, but I don't want, respectfully, I don't want to see reporting that says we're planning on closing events when we're not. We're not planning that yet. If we get to that point, we're going to specify to the maximum extent possible what sorts of things we're concerned about and what we are not, but we are certainly not there yet. Your other question was about asthma. I mentioned that we are concerned for sure. I'm someone who has mild asthma, but for folks who have severe asthma, especially and particularly kids with severe asthma, we have a real concern there. Again, we do not have a single nexus to the schools vis-a-vis kids at this point. We don't have a single symptomatic kid we know of, but we are watching very carefully. If we saw something else in schools, the ability to identify any kid with severe asthma, and I think that's a case where we would say, if we see a school situation we're concerned about, we want to get those kids isolated from that situation very quickly. That's just my common sense answer, but would you guys like to add?
Well, what I would add is that this is, as we have said in a previous press conference, a good time for individuals who have chronic underlying diseases to make sure that they are up to date on their refills and not to take for granted that, they can go to the pharmacy next week or the week after. We want to make sure that in the event that someone is symptomatic and they haven't gotten their flu shot, I need to get my daily plug-in, it's still not too late, that they have the medication that they need at their disposal. And one of the things that we've also been talking about is not only individuals, let's say that child with asthma, but especially older individuals who have chronic underlying diseases. We want to make sure that they are up to date with, their doctor's phone number so that they have the easiest possible access to care.
Can I do two things on that? One, would you remind people that site you can go to find out where you can get a flu shot?
Yes, you can go to our website, nyc.gov/health, and there's a flu tracker on there, and it'll tell you, or you can go to call 311 to get the pharmacy nearest you or the nearest H&H facility to you where you can get an immunization.
I want to come back on the prescription point, too. I want to make this a little vivid for everyone. So I think everyone understands here we are encouraging calm, and we're encouraging people to do the things they can do. But here's something where I want people to feel a little more urgency, which is on the prescriptions. A very, very different reality, but I remember vividly in the days after Hurricane Sandy, because of the disruption that occurred, pharmacies were closed, people could not get meds they needed. We're not in that kind of situation, but we all can imagine a crisis in which there's basic disruption of supply chain. That's not hard to imagine in this case at some point. So please, all New Yorkers, get your prescriptions filled now. Protect yourself, protect your family. Do not hesitate. Get them while you can get them. That's just smart for everyone. I hope we never get to a point where it's a consideration, but everything that people lay in now is in their interests. Go ahead.
Mr. Mayor, how are you addressing small business concerns? You know, we talked about Chinatown, but I'm hearing that restaurants where, let's say, groups or organizations have been scheduling events, you know, large dinners, that they're canceling on the restaurants, and so this has been happening.
Yeah, Juliet, I mean, I want to be clear about the sort of the serenity prayer here, what we can control and what we can't. I mean, what we're doing that I think is helping is telling people the facts very transparently and reminding people that, you know, life is going on in New York City. And I've been plenty of places in the city in the last few days where life looks pretty normal, actually. School attendance, Richard and I just discussed this today. In New York City, school attendance is higher than it was the same day a year ago. So New Yorkers, all of you have to obviously report a lot of information, including information that causes people some concern. New Yorkers are pretty tough, pretty resilient. They're generally going about their business. Some organizations, you're absolutely right, are making choices, some travel-related changes, et cetera. But I think the best thing we can all do is remind people, keep going about your lives, you know, keep going out and patronizing those businesses. We'll tell you the second we think you should change your behavior. Again, we're constantly communicating here, but right now, go about your business. Aaron?
For Chancellor Carranza, there's been some requests to provide private schools with sanitation materials so they can do the deep cleaning or disinfectants. Is that anything you plan to do?
So our approach to this is we are here to serve the children of New York City, all children. So we are working with our non-public schools, our charter schools, our community-based early education centers. They're getting all of the guidance that we're providing to the Department of Education. They're getting the same guidance. We have liaisons working with them. We are also providing cleaning supplies to all of those organizations and networks as well. And we are just considering them all part of the children of New York City, so we are working very closely with them.
Yes.
I have two questions. The first is, do the two cases today, are those New York City residents or are they being treated in New York City?
Residents.
Residents.
And being treated in New York City. Oh, I'm sorry. Go ahead.
What's being done to address the homeless population who may not have as much access to
We've spoken to this a couple different times, so a lot of your colleagues have heard this. I'll reiterate. Again, we have an extensive outreach initiative which has nothing to do with coronavirus. It's been going on for 3 years, but the positive outcome of that is that the vast majority of our street homeless folks we have very specific information on. Our outreach workers know them pretty personally, know if there's particular challenges that might be pertinent here, are talking to them to the maximum extent possible regularly. If anyone has symptoms, we're going to make health care available. If they have symptoms that indicate an immediate danger and they're not acting on it themselves, we have the power to have them come in involuntarily and get treatment. What's that?
Bringing the homeless population
If necessary, yes, but I don't think we have a single instance of that yet, but we have that power and ready to use it.
As far as the Madison students or any others who have been on school trips, have they been asked to quarantine? Are they doing that?
The Madison students right now are asymptomatic. The staff is asymptomatic, and they're almost at the end of the 14 days as well. So I think we have a little unusual situation there where the information flowed when it did, but I'll check with our doctors here, I think at this point, it wouldn't be a time to start a quarantine unless we saw something problematic.
Correct.
No need for it.
Yes.
In terms of the city's messaging for people who do develop symptoms, I know you've been saying people should go to their doctors, but a lot of doctors' offices are saying that they're not equipped to handle coronavirus, and they should go to the ER. But then ERs are saying that people should not go unless they need urgent care. So what can you clarify?
I want to pause you for a moment respectfully. I don't know who these people are who are saying what, and I don't know how widespread it is. Our message is abundantly clear. Get to health care. If you call your doctor and your doctor says, I can't see you, which I would question that doctor's approach to begin with, but then, yeah, you go to urgent care, you go to a health and hospitals clinic or hospital, go to health care wherever it is readily available. If you can't find it, call 311, which we've said incessantly, we'll tell you where to go. So your default is come to one of our facilities immediately. Go ahead.
I just want to clarify this. You were saying that you can test 1,000 people. Does this mean that, heaven forbid, we get to a point where there are 1,000 people who need testing? At that point, there's no longer the availability to do testing. And related to that, federal funding, Mr. Mayor, you were talking about the need for the federal government to step in to ensure we got enough funding for tests. Can you maybe tie
the funding? I actually feel better about the funding than I do about the testing. The Congress is acting, which is great, and I really want to commend Senator Schumer, who immediately noted how extensive this crisis was and raised the bar on the federal funding request. The president said days ago in his remarks that there would be reimbursement to localities. So that part actually has been more coherent than in some other situations. The test capacity, right now, we need to get to the point where we can do hundreds a day, every day, maybe even more at some point. And we're not there yet. We are not now. You've seen the numbers develop. I mean, right now, with 4 positive and 26 negative from the beginning of this crisis, we're still we want to stay there. We're in a very, very minimal dynamic at this moment. But we know it could move very quickly. We've seen that not anywhere. We've seen that in advanced industrialized nations like Italy and South Korea, where the numbers jumped in a matter of days. So we've got to get to more testing capacity. We can't do that alone. We need the federal government.
What I would add is that we're also partnering with our academic and commercial labs, and our understanding is that we will have some commercial lab capacity starting next week, and so that'll help a lot.
And just can you clarify about mandatory isolation? I assume this is just, maybe I shouldn't assume, but I assume this is just a term. It's not like has anyone refused to be isolated?
So it depends on the individuals that we're talking about. Dr. Daskalakis referred to how we monitor individuals that are on mandatory home isolation, where we do random checks to make sure that they're being compliant. And that the level of monitoring that we do really has to do with level of risk. And so there are, for example, individuals who may be returning from one of the affected countries where they are perfectly asymptomatic. We are asking them to be on home isolation. That doesn't mean they can't go out if they are asymptomatic. It does mean that we want them to minimize outdoor exposure, and the minute they have any kind of symptoms, cough, no matter how mild it is, a temperature, or feeling unwell, we want them to call us or their provider to get them to treatment as early as possible and get them tested. I mean, one of the things that the mayor has been really clear about is we want to make sure that New Yorkers who need a test get tested as soon as possible.
But I think, just following through the question, I don't think we have an instance of someone refusing
No.
mandatory or voluntary. I think that, because remember, before it ever became an issue for New York City, there have been weeks of people being pretty damn scared by what they were seeing, particularly in China. My sense here is we have a high level of adherence, a high level of interest in following the rules right now. Go ahead.
Is the city helping out folks financially who are on this mandatory 14-day or recommended 14-day isolation?
That's not part of what we do, to the best of my knowledge.
So we are working with our sister agencies to make sure that we put in place what we call wraparound services, which include, if someone is having mental health issues, if someone is having housing issues, we have measures in place in case someone does end up needing financial support, but honestly, we haven't come to that situation yet.
What kind of financial support these agencies might be able to provide?
So we're working, for example, with our Department of Social Services to determine, like, for example, we've already helped people enroll in insurance, right? So that's one way to help them financially. And our DSS partners are also working with us to figure out all the different ways that New Yorkers might need
but
help.
not income replacement if that's an issue. I just want to be really clear because I think sometimes I understand the questions, but there's the assumption the city government does what the state government does, federal government does, charitable organizations, et cetera, all wrapped in one. There are limits. No, I know, but I'm saying I think a lot of times just over many, many situations, there's sometimes a little bit of drift of what the city can and should do. Absolutely, we're going to help people. Absolutely, we're going to look for every service that we can provide, some of which has financial ramification. Income is their own reality. Hopefully, employers are going to be sensitive.
It said that dogs and cats, your pets, cannot catch this virus. Can they carry it? And other animals like mice, rats, and pigeons, can they carry this and give it to humans?
I'm going to defer to Dr. Daskalakis on that one.
We think that, we know that pets are fine. There are mixed data.
Did you say fine? I couldn't hear you.
They're fine.
Fine.
They're safe.
Okay.
So I think there's always data about shedding and identifying viruses, but so far nothing convincing that would make us concerned about our furry friends. So I think our cats and dogs are fine.
Okay, I'll finish up on this side, and I'll go back over that side. Go ahead.
Just to be clear about the students who traveled to Italy, not just the Madison students, but any students who've come back in the last 14 days, no one is showing symptoms, and so
No one. There's 1.1 million public school students. We don't have a single one we know of anywhere, any kind of student, who is showing a symptom.
Correct.
No, I just want to make sure you're hearing this first point. Anybody, if we get any more information about a nexus, we want to know it and act on it immediately. But just wanted you to hear the overall point. Did you have another question?
I just want to make sure no students have been asked to quarantine.
No. Go ahead.
Oh, hi. So I just talked to many small business owners in Chinatown and in Flushing, of course. They are very thankful for like mayor and also Corey Johnson come to Chinatown to have dinner to promote business. But what else the city or the city council can do, like financial aid, like or give them some sales reduce the sales credit or something, sales taxes reduce maybe. Any possible way you can do to help?
Look, I think there's clearly we're very concerned about these small businesses, and we're concerned about small businesses beyond that are starting to feel the effect around the city. We don't have an easy answer right now. We want to keep encouraging people to go out and live their lives and patronize those businesses, but we're certainly going to look at anything that we can do that would be helpful.
And I'm sorry if I'm making you repeat yourself. I know at the beginning you said that the numbers looked really good. I mean, pretty good.
Yeah, wait, let me be sure we're speaking the same language. You mean the overall testing numbers?
Correct.
Yes.
I just wanted you to put those in a little more context of how slowly this is spreading, or if we should still expect to see some exponential.
I think until 48 hours ago, then if you just were going by the numbers, you would feel very, very good. I think the last 48 hours are sobering. Community spread is an entirely different ballgame. And I don't want people to assume. I don't want people to overreact because this is going to be a day-to-day, hour-to-hour thing, which is why we're trying to constantly update you when we have information. The community spread is different. It makes it a lot harder for us to control the situation. That said, even though we now know it exists in New York City as a phenomenon, it is still striking that, of a city of 8.6 million people and a crisis that's been going on for 6 weeks or more, 4 people who are positive and 26 who are negative, and we do have a handful of pending tests as well. But, that's striking in comparison to what you've seen in some other places. And I do think it is because people are heeding the guidance, they're getting to care. We have obviously the most extensive healthcare apparatus anywhere on earth. That's all helping us. But we're all very sober right now about what tomorrow could bring or the day after that.
I don't think any of us would be surprised to have more individuals identified who show no nexus to travel to the affected areas. And that's why it's really important for New Yorkers to take measures now that we hope they've been taking into heart. And those are very simple. It's washing your hands frequently, covering your mouth and your nose when you cough or you sneeze. And, you know, I don't think I've sort of gone deep enough into why that's so important, right? And the reason why we want people to wash their hands frequently, because that's the way in which the virus can be introduced into your mouth, to your eyes, and those are the areas that are the easiest entry points for the virus. And so to the degree that New Yorkers, as I've said earlier, make alcohol-based hand sanitizers their best friends, if they don't have easy access to, you know, water sources, that's how they're going to keep themselves, their kids, their families, and their communities the safest. But again, we are in a situation where we are doing everything we can, as the mayor said, to contain. However, we would not be surprised to see other cases of community transmission.
Just a note, we'll take some more, but I know the speaker has a hearing starting at 3:30, and everyone here has to be a part of it, myself excluded, so, or almost everyone, I think. So we're going to take some more, but we need to wrap relatively soon. So this will be the last one on this side, then we're going over all the way to the left, and we'll take questions over there.
To clarify, the folks who you're urging to self-isolate who have been to those 5 countries, is that you're asking or you're telling them to do?
Which category are you talking about here?
Who have been to those 5 countries?
Oh, not the city employees, overall.
You're urging them, or you're saying you have to self-isolate and we're going to track if you do?
We're urging them to self-isolate.
I know you said, for now, Mr. Mayor, people are doing a strict adherence to the rules, but I think we all know that there are folks who don't follow the rules. So what are the consequences if you're supposed to quarantine and you don't? Are there fines? Would the police get involved? What are the consequences here?
So let's just go over the basic protocols that exist in a case like this. And obviously, again, I think a good way to think of this is we are climbing a ladder right now where we do see very good results on a voluntary level, and we do see good overall dynamics in the city. But this is indicative. So you saw community spread in the last 24 hours or so. You now see a commissioner's order indicating there could be a lot more coming behind this. We're going to get more and more mandatory as needed. But today, let's clarify where we are and then clarify the kind of history that has existed around previous quarantines.
So as we've said earlier, there hasn't been anyone on mandatory quarantine that has tried to, the term of art is elope. And, you know, I think it's important to note.
That's a new one.
Yeah. I think it's important to note that as the Department of Health, we have taken every measure possible to make it as easy as possible for these individuals to remain in quarantine. Above and beyond that, because we communicate with them on a regular basis, on a daily basis for those that are in mandatory quarantine, we develop a relationship with these individuals. And so it hasn't come to that. But if we were in a different scenario, you know, the powers that we have could include, the police powers that we have. No one wants it to come to that. And so that's why we take the investment and the time to put in those supportive services.
Ms. Ashley.
Questions. First, with the two most recent patients, the 40-something-year-old man and the 80-something-year-old woman, I think to some people it might be pretty worrisome that you all haven't identified the source of their infection. I'm wondering if you all have any hypotheses that you are evaluating or any kind of reasonable suspects. And then I'd like to ask a question after that.
So I'm going to start as the layman here. I want to caution, your question's fair, but I think it's, and I don't say this disrespectfully, I think it's 2 days late. I think community spread, if I'm understanding the doctors, you can't any longer find the specific origin. This is the whole reality. We started with a crisis where presumably the only way you could get this disease is someone came specifically from China. Then it turned into someone came from China, South Korea, Italy, et cetera. Now it's past all that. It's just out in our communities to some extent. And we are not in the practice of being able to say, here's where you go back to the origin point. What we would do in a case like that, with those two individuals we're doing right now, is say, okay, who are the people that you had enough direct contact with and that's the disease detective work, which we talked about a lot yesterday, to reasonably have a possibility of having spread this, the object lesson is the Westchester family, where the father manifested, and therefore there was the mother and the two kids. That was a very, very obvious universe. The other obvious universe was the law firm. So what I think will happen from now on is not a search for the origin, but a search person by person for their network that we then need to follow up on to make sure if they need testing, they get testing.
That you had to kind of look at that for the two of those individuals.
No, we said no, it's literally breaking them. It's, this is only in the last hours, and so the disease detectives are working with them and their families right now, or their families really, because both of them are in intensive care, to map those contacts. And then so I want to go back to the yeshiva example because it's the live other good example. The student from the Westchester family, undergrad at yeshiva, the disease detectives identified who are those people we need to follow up on. Two people, in fact, roommate, best friend, got to them, they've gotten tested, they came back negative. Repeat, repeat, repeat with every new case. That's what we're doing now.
Question. What's your advice to people who can't afford to take the time off? Either their employers won't allow them, they can't afford to lose the days at work. What's your advice to them?
Look, if anyone is sensitive to how much people struggle to make a living and how even a loss of a day's pay can be very, very problematic, but this is beyond anything we normally deal with. The last time, remember, there was a pandemic of this nature, it was 11 years ago. This one is still, that this disease is still not fully understood. That is a fact. No cure, no vaccine. We cannot play around. So even if it means economic suffering, people cannot take a chance with this disease. If you're told to stay home, you just have to stay home for yourself, for your family, for the good of everybody.
So I just wanted to confirm that the total universe of staffers at school who have self-isolated or self-quarantined is the 3 teachers, all of whom traveled to Italy?
Yes.
I had 2 questions. The first was, in terms of the lawyer, I know it was said that he had gone to Israel a few days prior. Does that mean there's a nexus there? Is there a search for a nexus?
We don't think so. I'll start and you guys will jump in. We don't think it's based on Israel. We think it's based on community, which is the first instance of community spread.
Right. His travel to Israel was in January, which is way beyond the incubation period.
And the other question I had was about the disease detectives. If you guys can go into a little bit of detail as to what that doorknob looks like. Are they checking, temperature, for instance? How long is their interaction with them? Whether it's
Again, I'm sorry to interrupt. This is someone now that they're talking to someone who we already have a concern about, and they're talking about them to figure out who are the other people in their world that we next need to get to.
So they are called disease detectives because it's exactly what they do. They investigate. They will interview either the primary individual who has a disease to identify what their emotion is. They will also talk, if they cannot speak to that primary person, to family and friends who are identified. They look at institutions where the individual has been and don't just say where have they been, but track them. So for instance, for school, they'll look at what class schedules are and also see if we can identify seating scenarios depending on who was around. If they were in other sort of meetings, again, they do the same thing. So it's really, it's very intensive and also always evolving. So, I think the mayor described it exactly, that you identify one person, you tell their friends tell their friends, and you get more and more sort of information about the circle of folks that you need to be concerned about or potentially not concerned about, depending on exposure.
And how about the folks that have already had a positive coronavirus? Throughout the days when a detective goes to their house, what's the protocol there?
So it's actually more than just spot visits. So for the individuals who are admitted to the hospital, the answer is very straightforward. They're continuously monitored. So that's very straightforward. It's the individuals who are on home isolation. We do spot checks to make sure they're complying to their mandatory quarantine. But additionally, we reach out to them daily to make sure that they're feeling well and that their needs are addressed. And so we really are, in effect, case managing them from a distance and then also spot checking them to make sure that they're compliant.
And how have they progressed up to today? I know you said that they're checking in daily, so are they better, or from the first case that are they better today as opposed to they were like day
So
one?
again, reminding you, and again, I'll make sure I'm articulating a lot, but I want everyone also listen carefully, because the lawyer, we said yesterday, the lawyer is already getting better, thank God, not entirely out of the woods, but getting better. The yeshiva student, better.
Correct.
Right? The health worker who was in Iran, better.
Correct.
So, again, this as we're learning this disease, there is, it's not just a one-way street, right? We are seeing people come through it and get better, and we're done with, and we're moving on to other people now. We've got 2 folks in particular now, though, we're worried about, the 2 new ones today. But the previous 2 actually are doing very well right now. Okay, I got to go to someone else. So I'll just let that one in because I think it's important. Doctors, what does better mean?
So for the 2 individuals in home isolation, there's not a lot of difference between sick and better at the moment.
Well, just clarify, you mean husband and wife?
Husband and
who
wife.
Came back from
Correct.
Iran. Right.
The
But
couple.
one is, again, careful. One's a positive, one's a negative, we're treating as a positive.
That is correct.
Okay. So their status right now, their health.
For lack of a better word, they're doing fabulously well.
Okay. The lawyer, what exactly can you tell us?
We can tell you that he is still in an intensive care unit, but that he's stable, doing better.
Okay. Let me go to the last 2, Rich and then Aaron. Go ahead.
So the 2 teachers that came back from vacation from Italy are now being tested.
Yeah.
They went into school one day, they didn't feel well.
We're going to confirm if it was 1 day or more, but it was a limited period of time for sure. They have been out of school for a period of time, and we're going to get you. So what I want to do on them is wrap it all in a bow, get the test results, get the school, all the facts, but I'm going to give you that. We also, as I said, we have some notifications to do. We'll get that to you either later on today or tomorrow. Go ahead.
Two things. Follow up on Ashley's question. Can you clarify, does the paid sick law apply if you are recommended isolation even if you're not actually sick?
Well, certainly, it would count under the 5 days. Right, for sure. Right? I mean, that's a no-brainer.
And as far as the guidance to travelers, that is a new guidance today that everyone coming from those countries should, okay. And can you just list the countries again since there are different levels of
Absolutely. And again, we track the CDC on China, Iran, Italy, South Korea. We disagree with the CDC on Japan. It is on our list. We think Japan should be treated the same as the other 4. We think they should put it on their list too. Okay? And we will see you again soon.
Is he also, does he work in New York?
Again, nexus to New York, but we are waiting to get more details on what that means. We will have that to you as soon as we have it. Thank you. Thanks, everyone.
Thank you.